Hello everyone, I am Shatrigna here. Basically, I am a physiotherapist. I reside in Hyderabad. Last week ago, I was suffering with chest pain. So on Saturday, I need to go to hospital and check it myself. What's wrong with me? It was like ECG. They done immediately after I went to hospital. The ECG was abnormal. They said like get it done angiogram. So there was no option because I was going through pain. It was too pain. Even I understand that something wrong with me, and it was as expected. In angiogram there were 5 blocks as per the medical terminology. Then and there itself in a private hospital where they said it's bypass, no other way you can have a thing. So they only said that like you can lead your normal life if you get it done, your bypass operated. So I was taking like multiple opinions from different doctors. So I knew Dr. Jitendra Jain sir, who is well known to me. He also treated my dad, my mom. So I was in contact with him. So he was giving me such a trust that no need to worry, you have a time, you can take some time, don't take decisions that immediately, you come, we'll see. On that day I went to Jitendra sir to meet on Monday morning. Now Jitendra sir is working in Yashoda hospitals, high-tech city. So morning I come here, me, my brothers and my sister's husband, we 4 members, we met Jitendra sir and we spoke almost 40 minutes actually. What good, what bad, how if I get it done operation, how if I go for angioplasty. There were different opinions and sir, the way we were asking and in the very smooth way Jitendra sir was replying, and we were absolutely convinced with the way the conversation went on with both of us. And at last we plan to move ahead with angioplasty. The doctor said if you want to go to angioplasty, it will be 5 stents all the way you need to take, he said. Then I said no problem sir, I am very much confident, you go ahead, I have assured to doctor. In the same way doctor said that if you are enough confident, your confidence will be your confidence will boost us. As the same way on the table, me and doctor sir both were discussing the way doctor was doing the operation. He was asking me how are you doing, and all the conversation went on. This procedure went on for almost 2 hours. After that, as usual, the operation was angioplasty was successful, and now I am here in front of you talking to you people. The only I am here because of the blessings of Dr. Jitendra sir. Yeah, coming to hospitality, nursing service, they are very polite, to be frank. It's not like they command us actually. Whatever we ask, they are replying in a very polite manner actually. And we need not to ask for anything actually. They themselves coming to the bedside, they are talking to the patients, whatever you want, medications on the time, food on the time, from morning, whatever the things to be happened, changing the bed, boys, housekeeping and nursing, all of them are very cooperative and very friendly. In fact, thank you everyone.
Hello everyone, I am Dr. Jitendra Jain, consultant intervention cardiologist working at Yashoda Hospital's high-tech city branch. So this patient by name Shatrugna, who is a physiotherapist, 35 young male, he has a strong family history of a coronary artery disease where both his father and mother had a history of heart disease. His mother has undergone a surgery, that is a bypass surgery, some 12 years back, and is on regular follow-up with me. And his father, he had a similar history of chest pain some 3 years back, where he presented to me at the hospital where I have done a primary angioplasty and I inserted 2 stents. Since then he was doing well for the past 3 years and is on regular follow-up. So this young gentleman, he was fine, only having a history of dyslipidemia, what you call it as a bad cholesterol. There is LDL levels were almost 300s, which I diagnosed him at 3 years back when he was treating his father. And at that time, I suggested him to go for a cholesterol tablet, which he used for some time and later stopped because of some reasons. So recently, this young gentleman had a history of chest pain in the late night, and he was taken to a local hospital there where he was diagnosed to have a heart attack, and an angiogram was done to him which revealed triple vessel disease, which means that there were 3 blockages in his heart. So having good faith in me, he came to me on the next day. I reviewed his angiogram and told that he has multiple blockages and surgery should be the first option. But seeing his mother and having a social phobia towards surgery, he said that he doesn't want bypass surgery. He wants to go for a multivessel angioplasty where using a newer technology like intravascular ultrasound will give much benefit. So taking the pros and cons, discussed with him after a couple of days, gave him time to think about that. He said he will go for a multivessel angioplasty, and I electively admitted him on the next day. So through the radial artery, that is through the hand, I cleared all those 5 blockages with 5 stents for that particular patient. In those, 2 stents were a biodegradable stent. You call it as a biovascular scaffold, where the stent dissolves after 2 to 3 years so that the metal load for the patient will be decreased. So after discussing with that, a multivessel angioplasty was done, putting 2 stents to the right, 3 stents to the left. After that, the procedure went well. Patient was stabilized and was discharged. He came for a follow-up again after 1 week. He was absolutely fine, doing well, and I explained him the importance of the medications which he has used for a long follow-up, and he was ready for that. So I was happy that the procedure went well, and the patient was also happy because he doesn't want a surgery for that particular patient. So thank you.